Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in North Potomac, Maryland, discussing the benefits of endodontics and how they can restore your dental health with minimal downtime and minimal discomfort with one of this area's top endodontists, Dr. Gail Davis. Dr. Davis earned her Doctor of Dental Surgery degree from Meharry Medical College in Nashville, Tennessee. She obtained her Master of Science degree in Endodontics from the University of Michigan. Welcome, Dr. Davis.
Thank you. Thank you for having me here today.
Oh, it's our pleasure to have you on. Your first time, in fact, on our program. We've got a lot to talk about. There's a patient interview that we're going to be doing a bit later as well. Okay. So I wanted to begin by asking you, doctor, if you can let us know what endodontics is.
Okay, sure. An endodontist deals with the inside of the tooth primarily. Okay? If we look at our mouths, we see a white clinical crown that's made up of white enamel. Well, next to that enamel is dentin, which is a hard mineralized layer. Next to the dentin is the pulp, or the nerve. The pulp is composed of blood vessels, nerves, and connective tissue.
Oh, so yes. It's basically related to the inside of the mouth and the areas you described with the tissue.
Exactly. It extends from the top of the tooth to the very tip of the roots.
How would you say that endodontics is different from general dentistry? In other words, the difference between an endodontist and a general dentist.
Right, right. Well, the endodontist has gone to dental school 4 years, just like the general dentist, but we have obtained advanced training by going an extra 2 or 3 years. Oh. Okay, we do routine cases just as a general dentist would do, but some of the cases are very difficult and very complex, and we also do endodontic surgery.
Oh, so you're certainly obviously specialized with a few years of extra training than, yes, say, a general dentist.
Yes.
So you can tackle and effectively handle situations and problems that a general dentist would not be able to, not to mention the fact that you also can perform endodontic surgery.
Right. Exactly.
So what would you say, Dr. Davis, are some of the advancements or advances that have taken place in the field of endodontics and how they can benefit viewers out there who have some problems that specialists like yourself can take care of?
Well, I must say that endodontics is not so archaic as it used to be. Technology has advanced tremendously. We use digital x-rays now, okay, which cuts the radiation down 80 to 90%, so that's a plus. Also, it allows the patient to see exactly what the doctor is seeing. So they're learning right along as the doctor is explaining the procedure to them. We use surgical microscopes also, which enhances magnification 21 times. So we're able to see far better than we were ever used to.
Those are significant.
Oh, absolutely, absolutely. Also, the obturating materials, and what that means is filling materials, what we fill the root canal with. We have so many more choices now.
Well, that's certainly good to know, doctor.
Yes.
And I was going to ask you, what problems would you say endodontics can correct for viewers out there who may be able to benefit from this field and dentists in your specialty? Okay.
Well, usually if a patient has noticed hot and cold sensitivity that's lingering in the tooth, if they've had trauma to the tooth, if they see any discoloration with the tooth, if they have acute pain that can only be relieved by analgesics, if they have extreme biting pressure, if pain comes out of nowhere that can travel to other areas of the mouth, if a swelling is noticed, in those cases, more than likely, the patient would need a root canal.
Oh, and at that point, they should get in touch with an endodontist.
Absolutely, absolutely.
What dental problems does an endodontist address or correct?
Okay, well, usually they will address teeth that have already been root canaled but are failing. Okay, they will address a tooth that needs surgery, that endodontic surgery I was speaking about, where there's residual infection that remains at the end of the root tip after the root canal's been done several years later. Okay. Also, we're also experienced at diagnosing oral facial pain or dealing with teeth that have undergone trauma.
So those are some very good things to know as far as what an endodontist is capable of correcting and fixing for a lot of folks out there.
Absolutely.
I think fall into one or two of those categories.
And I have one more.
Yes.
And that is calcified canals. And what that means is that's a canal space that's seen on the x-ray normally, but you can't see it. You don't, in other words, you don't see a canal space there. So usually the general dentist will refer those cases to an endodontist because it makes it more complicated for them.
Now, as far as time-wise, I know it would vary based on the patient, his or her problem or problems, but generally speaking, what takes place? They come in, you do a consult with them, you identify the problem, and say a root canal, for instance, because that's so common. What type of time are they looking at to get it fixed?
Well, we see emergency patients, so we'll see patients that same day. They call, we'll try to get them in because we try to accommodate them because they're in pain. So therefore, we will do an emergency procedure to get them out of pain. If we have room on our schedule, we'll just go ahead and do the root canal. And it usually takes anywhere from 45 minutes to maybe an hour and a half, depending on which tooth it is in the arch and how severe the infection is.
Well, that's nothing compared to removing that pain that can become so unbearable otherwise.
Absolutely. Absolutely.
Now, is there any discomfort or downtime that a patient may be looking at? Again, I'm sure that varies based on the treatment and the level of problem that they're experiencing, but generally speaking.
Generally speaking, our patients go back to work the same day.
Oh.
They just take pretty much over-the-counter pain meds or the prescription that's prescribed, and they go back to work unless they feel like playing hooky, you know, and some of them do. So, but otherwise they go back to work. Our job while the patient is in the chair is as a patient care team in this office. Our job is to minimize the patient's discomfort as much as possible, because let's face it, nobody wants to get a root canal. You hear the word root canal and fear, automatic fear. So to reduce the anxiety in our patients, we offer nitrous oxide sedation. So that works nicely and calms the patient down.
We're now going to meet some patients of Dr. Davis. Welcome, Anthony.
Thank you.
Oh, it's our pleasure to have you on. We always appreciate it when patients in their very busy lives take a few minutes and come down and share some of their experiences with us.
My pleasure.
So I wanted to begin, Anthony, if I may, by asking you, what dental problems were you experiencing prior to coming to Dr. Davis?
Well, my first appointment with Dr. Davis, I was referred to her from a prior primary care dentist. I required a root canal.
Okay.
Subsequent to that root canal, I had developed other issues, dental issues, more cavities, more problems, and some of the post-root canal treatment was not working well.
With the previous dentist?
With the previous dentist.
Yes.
As a matter of fact, I remember calling Dr. Davis one day and saying, I have to see you. I really do need to get in with you for just a few minutes. And sitting down with her and telling her, I haven't been able to eat anything hard. I can't eat steak.
Oh my God, now that's a sacrifice.
You know? It's a serious sacrifice.
Yes.
She actually took another look, and because of some of the prior work, I had developed infections, a number of issues. Not only did I get a referral to a different dentist, she actually worked to clean up to repair some of the damage that was created by a lot of the poor treatment that I had received before. And I should say, even subsequent to that, before I call a dentist, before I call my regular dentist, I call Dr. Davis and say, this is what's going on. How should I respond? You know, that give you an idea of how how well I appreciate, how much I appreciate the treatment that I received.
Well, that says a lot right there, Anthony. No doubt about it. And I'm sorry you went through some of the issues you did with the previous dentist before coming to Dr. Davis. And based on what you just told us, it sounds like you're extremely pleased to the point of totally trusting her with other dental-related issues even beyond endodontics.
Well, the fact that I still have teeth is a credit to her.
That speaks loudly, no doubt about that. Now, I wanted to ask you, for the viewers out there who may have, or maybe at the point where you were, where they are having a problem eating, heck, they can't even eat in some cases solid foods. What, for those folks who are out there watching right now, what was involved? What took place here once you came to Dr. Davis as far as...
Well, there were a couple of things that she was able to early on identify, and you know, working with the new dentist was able to rectify. One, obviously there had been, because of the treatment and the lack of response to the problems that the treatment had created, I had developed infections, serious infections. One of them required her to actually go back into 2 of the root canals that she had already done to medicate. And in addition to that, you know, one of the crowns that the prior doctor had put on was a metal crown, and it had I'm not sure of the detail. I just know that it was wrong.
Okay, so
it didn't fit.
So basically, like you said here in the last few minutes, that you certainly, it sounds like not only 1 or 2 problems, you had multiple problems. That resulted right down to an infection or 2 that you had received from work that was done from a previous dentist. Then you came to Dr. Davis, she medicated the infections, eliminated them, then did the necessary and correct treatment work that was needed to the point where you're now able to enjoy a steak dinner and other solid foods and not have any of those problems that you had before.
Absolutely. Absolutely.
And for the viewers out there watching as well, Anthony, what would you tell them about your experience with Dr. Gail Davis?
Well, Dr. Gail Davis is my first stop. As I like to think my clients use me as a first stop. Whenever I have a dental issue, she's my first call.
There you go. And that definitely says a lot about the trust and the confidence that you have in her. And on that note, I would like to thank you for joining us and being a guest on our program, Anthony.
Thank you very much.
Welcome, Allison.
Thank you. It's nice to be here.
Oh, it's our pleasure to have you on as well. And just like with Anthony, I wanted to begin by asking you as well, what dental problem or problems were you experiencing prior to coming to Dr. Davis?
Before I came to Dr. Davis, I was having some pain below my tooth, and so my dentist referred me to Dr. Gail Davis. And when I came, she took X-rays and looked at the problems and came to the conclusion that I would need root canals.
Oh, so you had root canals over here.
Did.
Oh my goodness, and how did that go for you?
Most people would get scared or a little nervous
Is that
coming
fear?
for a root
Oh
canal.
my God.
Yes, a root canal. It was a pleasure. I know that sounds strange, but Dr. Davis has this wonderful energy about her that just put me right at ease. And it was actually a very relaxing experience. I know that sounds very strange with a root canal, but it really was.
Well, that says a lot right there, because most people, like you touched on, Allison, have a fear of going to an endodontist, a dentist, and having a root canal. But for you to come here and share that experience with us, that for you it was really just like a regular visit without the root canal normal part that we all think is going to happen.
Yes. Painless,
and you just relaxed and went through it. I take it you're very pleased with the results.
I am, and I actually I'll have no problem if I ever need another root canal.
Well, there you go. Now, for the viewers out there, just like with Anthony, just like with you, Allison, please let us all know, what would you let them know about Dr. Davis?
If you need, any kind of endodontics work, then she's absolutely top choice. She is the best.
Well, on that note, I'd like to thank you as well for coming down and sharing your experience in your very busy day. So we appreciate it, Allison.
Thank you.
Hello, Carla. How are you?
Good.
It's so nice to have you on today as well. I understand you're 11 years old, right? And you live in this area with your family. And you were experiencing a lot of pain in one of your teeth. Is that what was happening?
Yeah.
And then what happened? You came to Dr. Davis?
Yes.
And what did she say, or what did she do?
They put a root. They did a root canal on my teeth.
Oh, so you had a root canal done. And did you feel any pain, Carla?
No.
No pain? None at all during a root canal?
No.
Dr. Davis just did a very nice, good job on you, and you didn't feel any pain. Was the pain gone when after the root canal procedure was done?
Yeah. Well, it only lasted 1 day.
That was it. That's wonderful. Were you able to go back and do and eat and everything that you normally would?
Yeah.
How long did you wait before you could go back and eat what you wanted?
Just a day.
That's it? And then you're fine?
Yeah.
I take it because you didn't have any pain during a root canal procedure, the pain's all gone, you're very happy that you're going to keep coming back to Dr. Davis anytime you need to see a dentist, right?
Yeah.
You like her? What would you tell the people that are watching, the other kids that are watching right now? What would you tell them about Dr. Davis?
She's a nice person, and she did a really good job, and it doesn't hurt at all.
Oh, I'm so happy to hear that. And on that note, thank you for coming down, Carla, and being a guest on TV.
It's nice to be here, too.
We're now back with Dr. Davis. I must say the patient seemed very pleased, Doctor. And now I wanted to ask you regarding follow-up visits, Doctor, for any of these treatments that you've described here today. Do patients need to come back maybe a month later or a few months later just for you to check on how things are, or is that not required?
Well, usually after 6 months, at the 6-month period, we send out a recall card. And that's just for patients to come back so we can follow up with their treatment and make sure that they are receiving optimum healing in that area.
Okay, so that's good to know.
Yes, yes.
I wanted to ask you, Dr. Davis, how long do the results last from, say, a root canal or some of the other treatments that you've described today?
What we like to see our patients do is follow up with their dentist after the root canal, no later than 2 weeks, for follow-up with a crown or either a permanent restoration. Because what happens is we have to now protect that root canal that's been done, okay, for the patient to have that tooth and for it to function like the rest of their teeth.
Not to mention eliminate the possibility of infection otherwise developing, right?
Or a fracture,
yes,
which would warrant extraction.
Yes. Dr. Davis, we've only got a few moments left, and I wanted to ask you what separates you and your practice apart from the other endodontists in this region. And the reason I ask that is you built a very strong reputation. You're certainly recognized as one of this area's leading endodontists, and I wanted to ask you what makes you all tick.
Thank you. Well, when you walk in our office, you will see a mission statement sitting on our table. Our mission statement says, at Dr. Davis's office, our patient care team will strive to provide the highest quality and most advanced care techniques while empathetically listening to your needs. Our goal is to satisfy our patients' endodontic needs by building a team of people who will develop and maintain a patient-oriented attitude. Our motto is, treat our patients with the same care we would expect to be given.
Well, that certainly says it all right there, not to mention the fact that from talking to Allison earlier, some other folks here, and from our research, we found that you really care about your patients. Not just you, but your staff. You guys treat them literally like family in so many cases.
Yes, we do. We really try to provide a service for our patients. You know, we really bend over backwards to help our patients in any way we can, whether it's calling them a cab or printing them in directions off MapQuest. I would honestly say that most of our patients have a great experience here at our office, as great as you can have one when you're getting a root canal done, that they even refer their family and friends, without a doubt.
Well, that certainly is a very powerful, anytime somebody is referring someone to a dentist, or in this case an endodontist, and talking about what a great experience they have, and you just touched on it, Doctor. Yeah. Talking about a root canal, something that most people have a fear of.
Absolutely.
And for patients to refer them to you, and to patients like Allison to talk so highly of you, it says it all. And on that note, I'd like to thank you for joining us, being a guest in our program. In fact, we'd love to have you back on again in the future.
Okay, thank you so much. I'd love to come back.
Oh, our pleasure.